My name's Matt Young. I'm a GP ordinarily, but once a week, myself and my mate Jossie Alone come out in a combi van and come to various drug rehab centres like this one at Logan and run a Hep C clinic. We bring everything we need with us. We bring the pathology lady, we bring the FibroScan team. On the first visit, we introduce ourselves, say good day. A second visit's needed in a few weeks' time, 4 weeks' time, and we start treatment. So we're trying to streamline the whole process and take Hep C cures to the people rather than waiting for them to come to the medical facilities. We looked at a number of our own patients that have hepatitis C at the dawn of this new era of Hep C treatment. And we found that a lot of them, despite being referred to the public hospitals, had never been treated. And there was a number of barriers to that. The first one was that a lot of people are not in a financial position to be able to get to the hospital. You know, taxi fares, bus fares, really stopped them from going and getting their appointments fulfilled. A lot of them were lost interest after long time delays on public hospital waiting lists. So for a variety of reasons, I suppose another one was the blood tests. People got really phobic about needles because obviously IV drug use tends to ruin your veins, and so getting a blood test is really quite a painful experience for people. You know, they might have to have half a dozen goes to get blood. We pride ourselves on having a very good blood collector, and if she can't get the blood, then myself or Jossie Alone do the job, and no one leaves here without their blood successfully taken. We pride ourselves on taking the cure to the people, and one of the first things that we wanted to do was make a welcoming environment, you know, and so that's the whole point of the combi. No one can be unhappy, no one can feel down in the dumps when there's a combi involved. Everyone's got some kind of a combi story to tell, ranging from their early life experiences right through to, you know, surfing or you know, weekends in Byron Bay or something like that. You know, so the combi is quite pivotal to the whole concept, that we want to present a warm environment where people are going to feel welcome. Wearing the pink flamingo shirts, again, no one can feel threatened when they're talking to a bloke wearing a pink flamingo shirt, you know, and the whole team's decked out. The first visit then, we want to have people feel welcome, as though we are very approachable. People come in, we talk a little bit about their experiences of IV drug use, and we get to know a little bit about what risk factors they might have for hepatitis C, any other diseases they have, we ask them about it, particularly things like hepatitis B and HIV. We want to know about their past medical history and medications. So there's a few medications that interact with the hepatitis C treatments, particularly things like proton pump inhibitors and H2 blockers and antacids, so anything for reflux or gastritis. Anti-epileptics are relevant, and cholesterol pills are relevant. So we want to know a little bit about their medical history and what medications they might be on. We want to know if they've had treatment before for hepatitis C, and we want to know if they've got any other liver disease particularly. As I said, Hep B, or if they've had alcohol problems in the past, if they've got a fatty liver, they've got diabetes that might predispose them to fatty liver. So they're the sorts of things that we're going to ask them. We give them a bit of an overview of the whole process, and then we'll personally take them down to another room, and in that room is the best blood taker in the world, and she does their blood tests, and then they get a FibroScan. So one of the rate limiting steps in getting hepatitis C treated is the need for a FibroScan, and a lot of radiology companies find it hard to have those on the floor in all of their offices, and so, you know, getting a person to get a FibroScan done is quite a process. And again, the old problem of paying for taxis or buses, parking, and the time delay to get it, often they lose interest in that meantime and they don't bother getting it. So part of the thing that we've tried to establish is it's a one-stop shop. They come in, they talk to the doctor, they get their blood test done, they get their FibroScan done. And a FibroScan, you know, for people that aren't familiar, is pretty much like an ultrasound. People just feel a little tiny tapping feeling on their liver. The whole point of doing a FibroScan is to establish the degree of fibrosis and the risk of cirrhosis in the person's liver. The blood test that we're looking at, obviously we're looking at how healthy their liver is, and so looking at a full blood count, and usually what we write on the form is hepatitis C serology plus or minus viral load, because the viral load is obviously interesting, and second of all, we want to know the genotype. And just as a bit of addition to that, when we do the LFTs, we're looking at the AST, and we take the platelet count from the full blood count, and from the platelet and the AST scores, we can work out what's called an APRI, APRI. And if the APRI score is less than 1, that's a really good indicator that there's not much chance of cirrhosis and fibrosis. Any APRI score over 1 really necessitates a more sensitive test to any problems with cirrhosis, and that test is the FibroScan. So, you know, probably about 70–75% of people, probably strictly speaking, don't really need a FibroScan, but we've got the machine here with us, and we'd rather just get it done while I've got the person in the room. The fibro scans are done for free. QML bulk bill all the pathology tests, and myself and Dr. Alone bulk bill all the consultation costs. So as far as the person coming in, they've got absolutely zero outlay for that first visit. If they do have to go on the medication for hepatitis C, again, it's through the PBS, and so it's your usual cost. If you've got a healthcare card, you're looking at about $6 a month. And it's a 3-month course, so they're looking at about $18 for a cure from a life-threatening disease. I suppose a lot of people have a few misconceptions about hepatitis C treatment. I suppose the old treatment of interferon was quite drastic and certainly knocked people around. You're looking at about a 40-odd% cure rate. People were looking at a 6 to 12-month program using drugs that really were quite savage, and the side effect profiles were quite grim. And so there's a lot of misconceptions still going around about the treatment of hepatitis C. The new treatments are unbelievable. You've got about a 5% rate of mild nausea and headache. That's the only side effects that people really notice, maybe an itchy throat and eyes. I've had no one had to stop treatment because of side effects, and we've treated about 250, Jossie alone and myself. So I think that misconception is still flourishing, particularly in people that have had Hep C for a while. They might have had friends that have had treatment before, and their friends have told them, oh, don't get that treatment, it doesn't work, and the side effect profile is a disaster. So we really want to try and get the message out there that these new drugs that come out last year and the year before really have revolutionised the treatment of hepatitis C. The side effect profile is hardly anything, and the cure rates are ridiculously good, 95 to 97% cure rates, which is just mind-blowing. So that's probably the biggest misconception that we're faced with. We wear Pink Flamingo shirts, we arrive in a combi, we're pretty laid-back sort of blokes, and generally speaking, I'd suggest that most people would find us quite approachable. We're happy to have a few laughs with people, put a whole positive vibe on the whole clinic. We're here to have fun, you know what I mean, and cure a few people of Hep C, and that's what we get a big kick out of. We can share that positive vibe with other people, like the people that work with us and the patients, then that's a real treat, I reckon. And from our point of view, what we get out of it is we get a huge thrill, you know, and I suppose that's one thing that I think is really important. I know a lot of doctors shy away from treating hepatitis C for a whole variety of reasons. One of the reasons I think is that it's a new regime, they've got to learn the new tricks, and they feel as though they've only got a small number of people with Hep C anyway. It's easier for them not to bother learning the new regimes. I'll just send it all to the hospital. Doctors need to be checking. When they check, it's a simple process. You know, there's only 2 or 3 simple steps that need to be taken to get people from having a life-threatening disease to walking out of there with a smile on their face. And the smiles that come on the people's faces when you say, look, here's your blood test, you're cured, it is life-changing for them. And the excitement, the spontaneous excitement that you experience as their doctor is something special, and it's probably the highlight of my whole medical career. Now, as a GP, we don't get to treat many life-threatening diseases, but this one is something really, really special. You're changing people's lives. And the other thing that I've noticed is that people feel infinitely better, and quite instantly better. You know, that lethargy that they've probably become accustomed to is removed, and all of a sudden they're feeling more energetic. They feel more positive, and all of a sudden, needles, not using them anymore. Why would I do that? Methadone, let's start weaning it down. So we've had several people that have said, I want to start weaning down. I'm not touching needles again. Everything's looking forward rather than looking backwards. And it's a life-changing, not just because you get rid of a virus in your liver, but it's a life-changing event for these people. Possibly the best thing that ever happens to them. So on the first visit, as I said, the people will see the doctor. The second step is they get a blood test, and that's utilised by the doctor to work out their APRI score to see what their state of their liver is, and they'll get a fibro scan to sort of definitively assess what their liver is doing as far as cirrhosis and fibrosis is concerned. So the blood tests take about 2 weeks to come back, and so we work on a rotating roster. We come to the same venue every 4th week. So 4 weeks later, the person comes back in, we'll have all the numbers in front of us, we'll work out their APRI score, look at their fibro scan score, we'll look at what genotype of hepatitis they've got, and then we'll hand them a script, and then we'll tell them, look, take one of these every day for 12 weeks, you'll have a 97% cure rate, you're extremely unlikely to have side effects, and you'll probably feel a whole lot better within a month or 2 with a lot more energy. You know, it's an example of the government and society investing in you because you're worth it, you know, and that makes people feel good about themselves in a lot of cases as well. Oftentimes we want to have another blood test at 4 weeks. Ideally, that's the case. Having blood taken is a huge ordeal for. We probably don't vitally need that, but the absolute one that we need is the blood test after they've had the 12 weeks of tablets. There's a 3-month window, and then we do a blood test at the end of that 3-month period. And that's the test that shows they're cured or they're not cured. And obviously they come in for the blood test and then they come back and see us for the results of that. The pharmacies take a while to get the drugs in sometimes. Because the drugs are very expensive, the chemists tend to want to see a script before they order it in. And so generally speaking, most chemists that I'm familiar with that have treated a number of my patients accept the script today, they'll have the drugs in tomorrow. So there's usually not a whole lot of hassle with that really. The other thing I suggest to people is you leave the repeats at the chemist because it's a bit of a hassle to get scripts, repeats reissued through the Medicare hotline if they lose them for some reason. Most chemists are happy enough to do that for people. Certainly a lot of people come into our Combi clinic knowing that they've got Hep C, and a lot of people come in wanting to get tested to see if they do. And the people that don't know if they have got it or not, if they come back in 4 weeks and we can tell them we've got some good news for you, you don't have Hep C, then I suppose it's one thing not to have Hep C now, it's another thing to make sure you don't get Hep C down the track. We counsel them on things like using needle and syringe exchange programs and things like that. We also remind them that you don't just get Hep C from sharing needles, you can get it from sharing paraphernalia like spoons and tourniquets and things. And we'll also hammer home the point that getting a yearly Hep C test is probably not such a bad idea, because the biggest thing about hepatitis C is, like any disease, you diagnose it early and treat it and cure it, you don't have any long-term problems. So regular tests, avoiding catching Hep C in the first place is really important. And I suppose while we're on that, we're big fans of the idea of bringing in a mate. If you know other people that use needles, if you know other people that you suspect may have Hep C, bring them down. Use your experience to inspire them. We've had lots of patients who we say, look here, you're cured, and they're so excited about that, they want to share that happiness with other people, and they bring their friends down. And that's, that word of mouth, if you like, is really a valuable tool for preventing hepatitis C complications, but also for preventing the spread of hepatitis C. One of the things that we like to talk about is, as far as talking to other doctors, is that this has been the highlight of my medical life. I don't have a particular interest in drug rehab, but that's part of my practice. But what I can say is that treating Hep C has been a revolutionary experience for me. It's certainly reinvigorated my interest in medicine and rejuvenated my interest in being a GP.
My name's Alf Lungi. Okay, well I come to see the doctors at the Logan clinic, and the Combi clinic came here, and the doctor asked me if I was interested in going on the program, and I said yes, and I went on, and I went through the process, and 3 months later I'm cured of Hep C after 27 years. Yeah, it was a life changer to me. It was like a collar around my neck. Before I couldn't go on holiday, I couldn't go anywhere, I was very lethargic. Now it's like my energy levels are up, my lifestyle's so much better, and they've saved my life. Well, I was surprised. I was expecting some side effects, but no, it was just 1 tablet a day, and the most I got was watery eyes at the most, and no, it was simple. I took 1 pill a day, stuck to it for I think it was 12 weeks, and yes, no. And then when I got my blood test results back, I had 5.6 million bad viruses pre-treatment in my blood system, and Hep C, and post-treatment blood test I had 0 bad viruses in my blood and Hep C clear. Well, I have the new medication. I have had other people say it's an old medication, and I've had to correct them on it. They're still fairly ignorant, but I think once they realise that there's no side effects and it's very easy, and the cure rate is like 97 to 98%, I'm sure they'll get on board. I did. Oh, everything was positive. They were so approachable. They give me gifts. All my bloods were all bulk billed, so expense-wise I didn't have to pay anything for all my scans, the FibroScan or the blood tests. They're very welcoming people. They come here, which is great, and we get things like vouchers and free chocolates, and free stuff is always good, and they save our life at the same time. So yeah, I found them very friendly, very helpful, and very good at their jobs. I didn't have any negative experience with doctors, but some doctors, they didn't really want to know. They just accepted the fact you had it, and if you were interested, basically you had to chase down any treatment that was available, and there weren't many options. And yeah, I did find a bit of a stigma and some prejudice, but then I gave up. But the people at the clinic and the Combi Clinic people have put me in the right direction, and it's been great ever since then. Not a problem. I will always recommend 100% come to the Combi Clinic, and they'll sort you out for free. Well, for $20 they'll save your life, and I think that's a bargain.